So typically, as far as bone health, I target 65 and older. So usually we start screening kind of more routinely at age 65. If you have other risk factors, like maybe you've been on chronic steroids or prednisone because of your asthma, or maybe you have rheumatoid arthritis or a family history of osteoporosis, smokers or women who drink more alcohol, they're more likely to have osteoporosis earlier. So we may start screening in the 50s depending, but usually it's 65. We do the bone density scan, so that kind of determines the strength of the bones. There's normal range, and then there's osteopenia. That's kind of mild bone loss. When you have osteopenia, we're talking about risk factor modification. Making sure you're taking calcium, 1,200 milligrams of calcium a day, either through diet or through supplements. You don't have to take supplements. Vitamin D, though, that a lot of people are lower in vitamin D. The skin cancer scare, you know, we're all covering up, we're wearing sunscreen, we're not getting out in the sun, and sometimes older adults are not getting in the sun as much either. So vitamin D, about between 400 and 2,000 international units a day, that can kind of help prevent bone loss. And then exercise, so weight-bearing exercise is one of the biggest things to prevent osteoporosis, osteopenia. So walking, you can walk, you can do light weights, that can help prevent that from worsening. If you have osteopenia, we usually check the bone density scan about every 3 to 4 years. It's not as often, and we monitor for changes. Once it's in the osteoporosis range, that's more serious. You're at an elevated risk of fractures. And so typically I start talking to people about lifestyle modification, but also medications for bone loss. Fosamax is one of the first things that we use. We use that once a week. It's a pill. You're supposed to take it on an empty stomach with a full glass of water and remain upright after you take it. If you take it and lay down, you're more likely to have heartburn or other side effects associated with it. What that medication does is it decreases our breakdown of the bone and kind of promotes bone strength so that our body can kind of build stronger bones, and then prevents them from becoming weaker. Not necessarily. Osteopenia is very common. I would honestly say majority of women develop osteopenia at some point in their life, but that's when we start doing the lifestyle modifications, and you can really slow that process down. There are some women that have osteopenia that we choose to be a little more aggressive at and treat, and they have an elevated FRAC score, so that's a fracture risk score, and we kind of take into account some other risk factors, and we have a score. If they're higher risk, then we may opt to treat them earlier because they are headed for that osteoporosis. Absolutely. A lot of people think that once I have osteoporosis, I will always have it and I can't make my bones stronger. It's just, we're going to try to slow it down. You can make your bones stronger through the lifestyle modifications and the medications, so you actually can get improvements.